Use-
So, hello everyone. I am Carolina Echeverria. I work for the School of Nursing and Health Professions, and I've had the pleasure to supporting the Sigma Beta Gamma chapter at USF. And we do have representatives from this chapter today. And also, we want to thank them for hosting and allowing four of our students to attend the Sigma Congress this year. They will be presenting their work. And I also want to thank the school, the San Jose Unified School District. They opened their doors and supported our BSN students to complete their work. So, with that said, I want to make sure that our students get a chance to introduce themselves. So, Christina, would you mind introducing yourself and then we'll go around?
Absolutely. My name is Christina Lips. I graduated from USF December of 2024, so just this last December. And in this last year, I've had my DMP project into completion, and I live in Fresno, but I've gone to school at USF for both my master's and my doctorate program.
Oh, nice. Very nice.
Thank you, Christina. Beatrice, do you want to follow?
Yes, hello. My name is Beatrice. Um, I'm currently a BSN undergrad student at the University of San Francisco. I'm currently in my fourth year, so I'll be graduating in May 2026.
Yeah.
But when my colleague Kennedy and we did this presentation, it was during our junior one semester, so it was about a year ago. Um, but yeah, we're so excited that we were able to be part of this, and thank you for this opportunity.
Nice.
Thank you, Beatrice. Kennedy?
Oops, you're on is she on mute? Or am I
Yes,
doing?
Pat, she'll mute herself. Thank
Okay.
you. So while Kennedy unmutes, Laura, do you want to introduce yourself?
Hi, my name is Laura. I am alumni from the USF Family Nurse Practitioner Doctorate Program. I'm also working as the nurse and then currently looking for a job as a nurse practitioner. And I was able to participate in this wonderful conference by doing my project. And yep, right here.
Great. Okay, well,
Thank you, Laura. Are you able to unmute Kennedy?
Yeah, I think she said
Ah,
it was loading, but I don't know if it is still right now.
okay. So whenever you're ready, we'll give you a chance to introduce yourselves. Thank you. And thank you all, the students and the Sigma representatives to be here. I think this is a great opportunity to learn from them. So I will pass it on to the students and they will be presenting a slideshow. Thank you.
All right, so this is a presentation that we all chipped in together, and it was a wonderful experience, and we're going to talk all about it. But just to give us a little context of date and time, this was in Seattle. It was during July 17th through the 20th, and it really just is bridging our Sigma Theta Tau with our University of San Francisco.
Christina, we can see the screen that says present. So if you
Oh,
can click present, so that way we can,
oh, I'm
there
sorry.
we go. That's perfect. Thank you.
Again,
You have to share the screen that is on full screen.
let me stop sharing. Hold on, because. Mm, mm,
Also,
mm.
I would love those pictures so we can post it on LinkedIn. So I'm going to put my email in the chat if you can send them all to me from your presentation in Seattle.
Sure.
We're going to have their presentation and we will have the opportunity to have it on our circle too,
Yeah, I want their
in our
pictures
chapter.
there when they were
Yeah,
presenting, not
yeah.
just a PowerPoint.
Absolutely. Thank you. You want to try again, Christina?
Yes, I'm actually going to download it because from the present view, I was having trouble to select that screen. So let me just download it because maybe that might be easier.
Okay. And I see Kennedy, you're back. Do you want to introduce yourself? So Kennedy is having issues with her audio, but she's also a BSN student and she worked with Beatrice on the project. Yay!
Can you
There
guys
she is.
can you guys hear me now?
Yes,
Yeah.
perfect. Thank you.
Perfect. It was loading. I'm so sorry, but I'm Kennedy Ventura. I'm currently a senior one nursing student. I'm part of the BSN program at USF. And as Beatrice mentioned, her and I were able to work our junior one semester to go ahead and start on this project and to see how far it's come. I'm so excited to be able to be here and share it with you guys.
Great. Thank you.
Wonderful. And while Christina is downloading and getting ready, I do see that we have some students that are supporting Beatrice, Kennedy, and Laura and Christina. Do consider applying in the future. So I'm glad that you're here to learn from them. And Christina, that looks awesome. We're good to go.
Yay.
Go ahead.
Okay, got it to work. Okay, so this was the Congress event. And I know we've already done our intros, but this was us collectively as a group together on our first day. So yeah, let's move on. When we first came together, we did this the open plenary session, and it was great for us to like really mingle a little bit. But we were also eating our lunch, and it was a great time. We did like a little dance session, and it was really just overwhelmingly inspiring, right? We were talking about the impact that we can do as nurses and some of the roles that have been carved from the people that are in this room, right? It was a wonderful time to really think about, what are our goals? What do we want to do with our lives? What's passion? What is success and what drives us to it, right? And so this was a great introductory session to just kind of collectively be together, see how ginormous we were in one ginormous room, but also like the backing we have, right? So we're all individual people, but together we are just a huge group that does a lot of good around the world. And that was such an inspiring moment to actually like realize and see that. Do you guys want to add anything else to that?
Oh yeah. So I think Kennedy and Beatrice and me were arrived early. But I think Kennedy and Beatrice was having a hard time arriving to the a conference. But when I arrived, my Google Watch was keep saying, "Oh, body response warning. I don't know if you're excited or stressed, but it is showing your heart rate is elevated." And it was for sure it was both, but it did really open up such a I never knew Sigma was this big, and I never knew it was this a big deal. And when I first arrived, there was so many nurses and so many studies that it show how many nurses are passionate about research and how many nurses are really serious about the quantitative research that nurses are producing. And the questions that they ask is not something like simple question like, "Oh, what was your project about?" It was just not that question, but it was more of, "Hey, so I see your project is about this. Can you tell me more about what you want us to help? Or is there anything that we can like help you out?" So there was more of like a comradeship and team building moment where these nurses really wanted the youngsters to really know what they're doing and really prep them. And it's such an eye-opening and it was so motivating.
Absolutely. I couldn't agree more.
I kind of want to bounce off of their ideas, but this is Beatrice and I's first conference. And so getting there, finding out where to go, where to stay, everything was a first time experience for us. But I just want to give a huge thank you to Laura and Christina for bringing us in. And although we go to the same school, I have never seen them probably at Evening of Evidence, but they were so welcoming to us. And it felt so nice having those people just make sure that we were okay, even though it wasn't their job or responsibility at all. But Laura was like, "Hey, we're gonna meet here," or "Hey, let's take the train back to the airport." And it was so helpful and kind of them to just take us in and be one group to show what USF is all about.
I just wanted to add that add on to that as well. I think compared to some of the other schools, there were like, especially the global schools, they're coming in a big group. So even though we weren't a big group, it was nice that the four of us who kind of held our ground together and then we traveled together too once we were able to meet up. So I think once we were able to meet up all together, it was really nice to be able to talk to one another despite like me and Kennedy, it was our first time meeting Christina and Laura in person that morning. But I think it was really nice. It was a really great experience that we were able to help each other out through this weekend or that weekend.
Mhm. So I wanted to just throw in this little slide about how busy it was, right? So I think this was something that I underestimated. Like I was expecting to go to like a research conference, present my stuff, and like, but this was jam-packed. It was every time we attended a session, it was trying to drink from a fire hose. There was so much to learn, and I feel like I was just scraping the top. And there was just everything that I learned wanted me to learn more about it. Like I just was it wasn't enough, right? It was like the more you know you don't know. And so it was great, but every single moment there was something planned. And so it was kind of like, okay, so while I'm in this, what am I going to do next? Okay, it's going to be the next concurrent session. So I need to figure out of these 50 topics, which ones are we going to go to, right? And it was a great experience. I feel like if I had this beforehand, I would have maybe had like a set, almost like a tour guide of like, okay, I'm going to do this first, then I'm going to do that next. And, I looked at this article and I have 50 questions about that one. And, I feel like there was so much to do. And this just kind of is like a little snapshot of like this is just the time. This is not even looking into like, oh, what is concurrent session do you have? Right. So I kept on referring back to these pages right here in our little handbook because this really helped guide where I was going to go next and what to expect. Is it going to be a downtime? Is this a mingle network time? Or is this like a full force? Let's go to our next session and, buckle down, get ready to learn. Right. And so, yeah, I just tossed this in last minute as like a little guide of like, we were busy every single minute and it was great.
We were so eager. Right. Oh, sorry, Kennedy, go for it.
So I do also want to mention that we actually had apps on our phone with the same schedule, which was really interesting to include technology as well as some people may not like looking through the book that they gave us. So having it on our phone, we were able to see, okay, this is where this room is at. So having two different sources for us was extremely helpful.
Yeah, it's great.
Mhm.
It was it was full. So me and Kennedy, Beatrice, and Christina, what we happened was, oh, okay, let's meet at here. But then all four of us were like, oh, wait, that study, oh, that presentation looks so interesting. So we end up ditching everybody. And then at the end, we're like, wait, where are you guys? It's lunchtime. So let's eat together. So then we rejoin together and then we get separated again because the topics that they were presenting was no longer, it's like, oh, we should be together. It's no longer like that. It was more of like each of us had a very different motivation and different view of our perspectives on nursing. And each of us were more like interested in specific contents. For me, I was interested in like emergency nurses or the retention of the advanced practitioner in the ER. All those like studies were such an like hype for me, but then Christina was more of like, oh, there's a leadership. Oh, there's an education. There's an AI usage in the healthcare field. So then she was
That
going
was
more
an
toward.
awesome session.
So it was very interesting focus and of the topic that each of the nurses had a choice to choose. It was such a wide variety of buffet for us, and it's just so wonderful.
I completely agree. I think going into this, when we saw this general schedule, we saw, okay, so we have like about an hour to go to concurrent sessions, but it was only when I looked further into the app and looking all the specific details of, oh, who was presenting, what were they presenting on, and then they were also having like multiple presentations all happening at the same time. I know Kennedy and I we kind of struggled for a little bit. We were trying to figure out, okay, which one do we really want to see and what time is it so we can be there. We would have instances where there would be two concurrent sessions that would be happening at the same time that we wanted to go to. So sometimes that's when we had to learn that, okay, maybe if we split up, then we can just talk about it when we get back. But yeah, this map or this schedule for the weekend, I feel like is just the very surface of what there was at the conference. So it was very enriching, very insightful and very inspiring to learn from all these nurses that did their project.
Absolutely. Absolutely. Yeah. And I guess like we kind of use this as like a little map, and then we use the app as like the true like details to all the things, right? So, and it was almost like you have to have both and you have to use them concurrently and say, okay, I want this, and then I'm going to go this, and this is the time. And it was great to actually have both. Absolutely. All right.
Yep, so this is Beatrice and I's presentation that we went ahead and presented at Sigma, and it's for improving sleep quality and adolescent health. And so where this really stemmed off was when we were in our junior one clinical. It was our mental health and community rotation, and we were able to go to San Jose Unified District, one of their schools, and work with adolescents in that community. And it was a full circle moment for myself just because I am from San Jose, and being in those type of districts, you see, as a student, you see what is around you, but then looking outside as a nursing student now, looking at those students, you see, so it's a whole different perspective. And what we really saw was that sleep wasn't prevalent in schools at all. It was barely talked about. All of the students would come into the health office with such unhappiness and just not being able to function properly. And you see that and you want to help them. But what we're saying may not be what's beneficial to them or may not be what they want in that moment. So just creating a safe space for them. We were able to see that with Greg and Susan, who we worked closely with. And so our goal was to then inform adolescents about the impact of sleep quality. And by that, we created a what was it?
The poster?
Poster, yeah. It was a mini poster that we could hand out to students, and you'll see it in the next photos. And just doing that, you could see their interest sparked, but only for that little time period. So then we knew we wanted to progress and make this bigger. How can we make an impact on these students by not just being another teacher saying, this is what you need to do, this is how you do it, but instead talking to them, saying, hey, how many hours of sleep did you get last night? Did you eat dinner? Did you spend time with your family before going to bed? Did you take a shower? Were you able to read a book? And so that's where we included the sleep hygiene, the healthy sleep, and doing more research on how much sleep should these students be getting in general. And if B, you want to incorporate our findings kind of and why we wanted to do more than just that.
Yeah, of course. I just want to add on. So when Kennedy and I went to the middle school, we first just had like a little flyer of a little information of, oh, why you should be receiving sleep, why you should be getting enough sleep, and how it affects like your physical health, your mental health, how you feel. And then after that day, after that health teaching at the San Jose Unified School District, we decided to take our findings that we learned from the students and then we put it into this poster to bring to Sigma. So some of our findings were that I feel like unsurprisingly, unfortunately, that these students do not get enough sleep. And there are many factors that go into it, such as the screen time, the lack of bedtime routine, family dynamic. We learned, I think that surprised me the most, had like a great impact on how students or adolescents go to sleep in their nighttime routine. Um, I think it's because a lot of what the students will see with their parents is a pretty good indicator of how they will take on for their entire lives or for the rest of their lives as they become adults. So I think it's really so important for parents to also set good rules for their students as well so that they may implement those and take those on with them as they grow up. As well as there are other things that also contribute to their sleep, which are social activities and unhealthy eating habits. So it really just shows like holistically, like these students do need to be supported, especially as an adolescent in middle school, just so that it could also prep them for when they're older. So our evaluation for the research is that we do need to improve adolescent sleep quality and implementing. And Kennedy and I wanted to start by just implementing our teaching. So these students, I don't know if they'll remember us in a few years, but maybe hopefully that they remembered like, oh yeah, there's these two girls nursing students. They gave us like a purple flyer saying, oh, sleep was important and it helped me. I needed to sleep so that I could help be stronger in sports or I can perform better with my grades. So we just hope that the earlier the primary prevention of all of these possible later on difficulties might be prevented with our teaching.
Very nice.
Yeah, I also wanted to include, sorry, one last thing was that this teaching that we did, just coming off of a flyer and now presenting it to Sigma in this type of way, means that we can take this research even further and may possibly come back to Sigma, which a lot of the professionals that we've met suggested us to do, which I found so motivating to becoming a nurse and after graduation as well, because although it's evidence-based practice, it comes in steps. It's not just here are all my findings, this is what happened. I truly believe that if you have an idea and you want to research something, start small, like we did the flyer, then go to Sigma possibly if you can, do something and show them these are my findings for now, but then also emphasize that with any project, further research can be done. And hopefully B and I will be able to come back together in the future and progress what we have learned.
Mm-hmm. That's actually a really good point too. That's something that's I think a big takeaway from like this entire experience is that a lot of the people that had been presenting to us, they didn't just like say, okay, this is my research and now I'm done. It was like lifelong research, right? That they kept on building and kept on growing. And then it's like the more they did research on this and they had to like segue and do something else also. So it was absolutely fascinating. My research, my project was about primary care provider education. And one thing I really enjoyed about this experience was that I got to basically like one-on-one talk to my audience, right? So it depends if like the poster person next to me was a BSN person and she did a phenomenal project. So I got to listen to her and her presentation basically about her research. And then she came and talked to me about mine. And so I had the perspective of like, okay, how do I tailor my project to the audience of someone who is a BSN student versus someone who is already a provider, right? And so that looked very different. But and then also too, there were people from like Korea who came by and saw my poster, and you know, just all around the world, and it was all around the United States, and it was just so fascinating to see kind of like the exchange of information. So my project was about the diabetes resources that we have available online and basically connecting that information to primary care providers to help them shape their practice in how they give their education to their diabetes patients. So I did a lot of research on like what kind of background do we have on like what education do providers get? Some things on like what are some potentially lacking areas, right? And I did my gap analysis on going to a provider's practice and seeing, you know, what resources do you give to people? What do you feel comfortable with? Do you understand G-code billing specifically for diabetes? Do you know your resources online? And then like, do you just refer out to a specialist, right? And so I kind of really got a chance to look at some of the practices that they have. And it was really interesting because some of what I was seeing in practice was supported by research, really. And so, so it was fascinating. And then what I extrapolated from those experiences was that basically diabetes self-management education and support really has to be tailored to the individual person, which makes sense in a lot of avenues, but it should include digital platforms so that we can reach more of a wide variety of students. And also, and there has to be some type of like billing aspect to understanding what providers can do, right? Because that's kind of like an element of return on investment, really. And so my project included a 5-point Likert scale to assess baseline providers' comfortability with G-code billing, available resources online, how to address barriers to diabetes self-management education and support, when to refer to a specialist, and a number of other elements. Then I gave them basically like a walkthrough online of like some things that they have available, PowerPoint presentation on some of the things that they can use. And I really highlighted the CDC's Diabetes Self-Management Education and Support Toolkit. So that was a resource that many of them didn't know existed. And so basically, afterwards, I did another 5-point Likert scale survey, and I included some other questions that were a little bit more about general, like, did your practice change? Is there anything, any feedback that I can get from you, right? And I kept it a little bit more general. And it was my sample size was small, it was only 2 providers, but it was a really good pilot, right? And again, to springboard off of what Kennedy was saying about like, just using that information and then you can also do more research on it, right? This was just like a stepping stone and it could be something further on.
Very nice. Very nice.
So this is about faith-based transitional care models. So my project is about pretty much to address the readmission rate through utilizing a faith community nurses. But at this moment, the ANA is no longer providing a certification. Therefore, it is more of a volunteer faith community nurses. And this whole pilot project was to establish the common knowledge and verbatim and also the understanding the foundation knowledge about what is faith-based transitional care model is about and what is the volunteers that is going to volunteer for this program are expected to, like what are their responsibilities and roles. And those were the knowledge attainment was assessed by our wonderful Dr. Zebert, who is actually a creator of faith community nurse transitional care model. She helped me to create a tool to assess the knowledge attainment of our church volunteers, our community church volunteers in Salinas, to see if they truly understood project-led education offering regards to faith-based community health nurses with transitional care model. So transitional care model, it is different than home health nursing. It's because the transitional care model is solely focused on a patient who get admitted at the hospital within 30 to 90 days and check if their disease are qualifying in one of the hospital readmission rate reduction program that is rolled out here in California Medicaid systems. And if these patients who are admitted in those specific criteria of the chronic and the conditions comes back to the hospital within 30 to 90 days, the hospital actually loses a certain percentage of the reimbursement from the CMS. Therefore, my project somehow got very interested at my work here in Salinas Valley Health Hospital because our hospital is the only community hospital that is first magnetic hospital out of whole Central Coast region. Second, this hospital, due to the evidence-based practice that one of the master level nurses proposed about creating a transitional care department, and now this hospital has transitional care department, the one and only department that is in the hospital here in Central Coast. What a great story, right? The nurses led project finally shown, and I am carrying that torch again, not
Yeah.
only for the hospital, but I am trying to carry the torch to the community health. So I'm trying to reach out to the community churches who are really keen on their elders, because I personally experienced one of my elders passed away in cardiac arrest during the fishing trip, but he had a cardiac surgery, it's like stent placed twice and all that, and he yet still failed to understand what he truly had, and he did not manage his condition well, and he passed away, and that became the passion of my project. And this project basically successfully recruited 15 church members who are healthcare professionals. So I was very fortunate enough to had a two MD residents, and I had one medical doctor. And then I also had three PAs and social workers and it was just wonderful how they showed the passion and they did understand the training materials that I did offer to them. And as you can see, my p-value was 0.0023 on our group, meaning they understood the content, and they were fully ready to go for this project. When I presented this project at Sigma, many people were very confused. They did not know what faith community nurse was, and they did not know there was such a program as transitional care program. And some of the nurses were like, this is the exact program that we need at our state. Or one of the Mongolian nurse came to me and she was like, wait, what did you say? What was the model? And it was just great to know that not many nurses are familiar what readmission rate does is to the hospital. So I think that is one of the registration side that United States kind of kicked in to attempt to address it. And I had such a great, wonderful time here and sharing just one perspective that nobody was familiar with.
I think that's great.
That's awesome. Yeah. Okay, back to you, Kennedy.
Yeah, so I don't think there's enough words to describe my experience at Sigma. I truly wish each and every person I know was able to come with me just because being there is different than explaining it. So attending the Sigma Congress was a highly meaningful experience. Like I said, it was motivating to be recognized and encouraged for my involvement. And I appreciated the opportunity to learn from so many diverse and compassionate professionals. While I listened to many speakers and presentations throughout the entire weekend, the one that stuck out to me the most was learning about the 4 Rs, which is refresh, reframe, remember, and resources, as they allowed me to reflect on my growth as a nursing student. The conference really helped me refresh my foundational knowledge about global health and evidence-based practice. I learned how important research is in supporting preventative care and how we can reframe healthcare to focus more on wellness, not just illness. And our care begins with the knowledge we gain and the insights we uncover together ultimately. So from that, I wanted to just make bullet points. So expanding global health knowledge. Like I mentioned, I learned new nursing concepts I never heard of before. I gained a deeper understanding of how healthcare systems and challenges vary worldwide. It's not all the same at all. And then exposure to real world case studies and evidence-based practices. In a picture coming up, it shows a woman and I whose project was on sepsis among postpartum mothers from Bangladesh. And just walking through these posters, it felt like a museum. And she just so happened to be there. And I kind of glanced because I was still nervous to go up to people, but she was very welcoming. And we took a picture together. And I was like, thank you for sharing this. It's so amazing to hear that this is what's going on in this part of the world that I had no idea about. And then another one just down the road was about high fidelity simulation training on pediatric nurses' competence in seizure management. But it was from Taiwan. And this presenter wasn't there, but it made me have so many questions like, are there healthcare systems like ours? Are the schools that are there teaching their students what we're learning? And so having those questions, I made sure to write them down and share later on, and which leads me to applying skill through presentation. When Beatrice and I presented our project, we had to organize a way for this specific event just because we came from informing children and then to faculty members, but now this was to strangers. We had no idea who we would see. And it was a funny story, actually. One of this really nice lady came up to us with her camera and said, okay, you have 2 minutes to give me your presentation. And Beatrice and I couldn't make any faces or anything, but we were like, okay, we got this, be confident. And so that's what built our confidence, was having people believe in us. And although we may have been the youngest people there, they truly did not see us any different. And I'm very thankful for that, because having so many different levels, they still encourage us, and that motivates me to keep going and make sure that I make them proud in a way, kind of like how I make parents proud, teachers proud, and everything like that. And so it practiced critical thinking skills as well, responding to feedback, quick questions. We didn't have no time to think, it's on the fly. And I feel like as a nursing student, some people may be nervous for that, but Beatrice and I had to like channel our inner future nurses and just gave them the answers that we felt was best. And so then again, leading to my next point is that we were able to connect our theory to practice. So just like we learned in classroom concepts, we applied to talking to other people. We understood like global health challenges from multiple perspectives instead of just one tiny perspective. And so then we were able to bridge nursing theories as well with like international health concerns, which was very interesting. And I want to say that this was a beautiful experience to bridge into our way into senior year, just because now we actually get to learn about adolescent health and see what our findings and what we could do different. And I'm very thankful that our curriculum provides such amazing feedback as well. I also gained cultural competence awareness, interacted with peer professionals from different cultures. I realized the importance of cultural sensitive and patient care and teamwork, as well developed a broader worldview and appreciation for diversity in nursing. It's so important for me that diversity in nursing is essential because it enhances the cultural competence, allowing nurses to provide more respectful and effective care, and still learning that as a nursing student and being able to implement that in clinicals early now allows me to get better as I become a nurse as well. I was inspired by the global passion. I felt inspired by the dedication of nurses worldwide. Talking with nurses and researchers from every single part of the world, it's important to understand each other because we all have different viewpoints, but our one purpose is caring for someone, which is very beautiful to me again. And there's moments of pride and emotion, seeing shared passion. What I felt, like I said, cannot put into words the interactions I've made with people, and simply them passing by our presentation made me feel honored and that I was being heard for what I truly believe in and what I want to share more of. And it reinforced my commitment to nursing and global health equity. It was a reminder of why I chose nursing to make a real impact, no matter how big or small it is. And it has how the profession has such a big community and village to support me in doing so. So I know that I made the right choice and I was exactly where I needed to be while at Sigma. And finally, a motivated lifelong learning mindset, as Christina has mentioned. I saw the importance of continuous education. I felt inspired and challenged at the same time. I now see that learning how to learn means asking better questions and believing I can and will change systems. I'm eager to further my research and take part in projects all over the world that help improve policies. And I learned the value of staying curious. And I even learned in class the past week that you are learning something new every day, whether that's in your personal life or professional. And so from this experience overall, I'm committed to staying informed and becoming a self-directed learner. I've gained tools, ideas, and mentors that will guide me through this next chapter, especially entering my senior year and my transition into life after graduation as a new grad. Here's some pictures I wanted to share as well. As I mentioned, a very nice lady in the upper right-hand corner in her presentation. She wanted to take a picture. I said, okay, is it okay if I get one too as well? And a special thank you to Beatrice for creating this project with me. If it wasn't for her, we would not be where we were at today. Especially Dr. Mary Lou, who believed in us, who knew we could go to the next level, and just sharing that experience with her was truly amazing. And little snippets of Sigma, the big museum-like poster boards I was telling you about, and each presentation had a schedule right in front of its door as well.
All right, Kennedy, I feel like you spoke so beautifully. I think that was a great encapsulation of our experience. But yeah, it's similar to what Kennedy said. I feel like words cannot even begin to describe all the emotions, all the feelings, the entire weekend, everything that we felt that entire weekend. Really, it was so inspiring to see so many nurses. I feel like when Kennedy and I came there at 9 a.m. on the Friday that the conference started, um, it was just so overwhelming, but at the same time, it was so incredibly like it's sorry, I feel like I'm at a loss for words, but it was just so inspiring just to see everyone, and it was such an immense feeling to feel like oh, you are with people from all over the world. And you could really feel that. And you could feel and hear the spirit and the pride from all the other people from the different countries, the like different states within the US, and globally. Like I was talking to a woman from Dubai, like around the Dubai area. Then there are other people from Texas, they're from Utah. I also saw some people from like Taiwan, and just there's so many people around the world, and you realize we were all gathered here for this one Congress for just to share our learning and to share the experiences and to share what they have all been researching and feel so passionately about. And for every single concurrent session that I sat into, I just felt so inspired listening to them because everything they spoke about, even if I had no prior knowledge about the topic, it just made me want to learn more about it. And their passion and their drive for their topic was truly inspiring to see like these people, like similar to again what Kennedy said earlier, people devote their lives to a particular research project, or they continue building off of the research that they find, and then they like until probably there's no end, or they just keep wanting to learn more about whatever topic they feel so passionately about. And that I found was really truly incredible to witness. Um, so yeah, with all the concurrent sessions, there were again so many that I wanted to sit into, but I feel like there just wasn't enough time, or there would I just if I could duplicate myself and then put each one in each different room and then take notes, I wish I could, because there was just a plethora of information and good just presentations that there were to be heard that I wish I could listen to every single one, but it just wasn't humanly possible with the thousands of people that were here at this conference. Um, but yeah, so we connected from people from all over the world. Like, I knew it was global, but stepping foot into the hotel and then just fully seeing, hearing like all the different flags, all the different like languages you'd hear, the different accents, it truly did feel like, oh, I am one small person in this big world of incredible people, and incredible nurses that are trying to make a difference in just our world entirely. So I feel like that was just such an amazing experience. I feel so blessed be have to have been nominated for this. So, and I also thank Kennedy for the teamwork that we had, and through the teamwork that we had in creating this project, and as well as what got us through the weekend itself. Kennedy and I have been working on this together for a while now, and thank you again, Dr. De Natale, for kind of encouraging me and Kennedy even to present at the evening of evidence, because I feel like it would be the email for the evening of evidence was something that like I feel like many students would see, but either they didn't have the motivation or the encouragement or the support to show up. So with Dr. De Natale on our side and saying like, oh yeah, you guys should present your project. Like I think it would be fun. Kennedy and I kind of looked at each other and said, okay, like at least we have one another. We can do it. And I think that just support was incredibly impactful for how we even got here. I never would have thought that saying yes to Dr. Mary Lou's, oh, why don't you present at the evening of evidence would have got us to be a rising star at Sigma, and then would have got us to Seattle, getting to talk to people from all over the world. So thank you so much for this experience. I also mentioned that I was inspired. I feel like the word that I keep using is inspired. Um, but after this semester, I was actually previously um, told that I could apply for the 4+1 at USF, the BSN MSN program. And after learning more about it, I just realized how incredibly like how it is such a good opportunity for me to take. And I think after going to this Sigma conference, it just made me even more excited to start my MSN journey too. So even though I haven't even graduated from my BSN yet, I'm so already excited to start my higher education. I'm already excited to start my master's at USF. Um, Yes, yeah, and then talking to so many nurse researchers when we sat at a networking table with me and Kennedy, I think we were just talking to like people were all kind of just sharing their projects with one another. And you could just feel the passion with their tone, with their research that like when they were networking, it truly did feel like networking in front of our eyes. Like Kennedy and I feel like I had a moment where I just had to like sit back a little bit and just watch that these people were fully just connecting with one another, networking with one another. One person that was sitting next to me was talking to a different woman from Finland, and they'd had written multiple articles on the research databases. And she asked, like, "Oh, do you know this person from Finland?" And then the woman from Finland said, like, "Oh, yeah, I think I know that person. Like, oh, I connected with them." So then they were trying to exchange contact information so that they can build upon their own research projects. And I just thought it was incredible to see that the names that we'd see on the databases were real people and the faces behind some of them, and that they really were like just so passionate about their project that they were even able to connect to one another. So it made me feel like, wow, this world is so big, and yet it's also so small at the same time. That what are the chances that they're sitting at the same table, that they're able to help one another pursue their research further. So I just thought that was incredible. But yeah, thank you again for this opportunity. It really is so amazing that we're able to be part of this. Oh, yes. And then this is just more pictures. This first one to the very left was actually taken from the school nurse, Greg, from Castillero Middle School in San Jose. And this was what our teaching looked like for the students. So here are the middle schoolers that we just kind of just sat down at a table during their lunch break. And then they would kind of, obviously, they'd see like people like, oh, these girls don't look like their classmates are middle schoolers as well. So I thought it was just very fascinating that we were just able, we had the opportunity to just sit down at a table. We were able to hand out flyers. And something that isn't pictured here, but I think was pictured on our poster was the sleep tracker. So that's where students were able to kind of log, oh, the date, how many hours of sleep they got. And most importantly, how did they feel the next morning? So that did they feel ready for the day, or did they feel tired? Did they feel like they couldn't focus? Because that truly is the most important part of how you feel each time you wake up. And then these other two pictures, this middle one is a picture that Kennedy and I took behind that Sigma background. And then the one to the very right is with a woman named Bernadette Melanink, I believe is her name. She was the opening plenary speaker that Carolina actually advised us to go listen to. And she was truly inspiring. I looked her up on her LinkedIn afterwards, and I saw her first title wasn't, I was expecting her to say like, oh, her first title was to be a nurse, but her first title was actually a motivational speaker. And I could really feel that from her presentation, when I think she was the great way to kick off the weekend event, because she really was just truly inspiring with her words. She knew how to get to the root of each person, each nurse and each person that was sitting in that room. So I think it was incredible that we were able to kind of just meet her, shake her hand, like give her a hug, and then also take a picture with her.
That's great.
All right, this is me. Okay, so first of all, Kennedy and Beatrice already said everything. So if we could just say ditto. But yeah, absolutely. To reiterate, right? Say the same things over. But I love the global perspective, right? You walk into the room and you really just feel like I'm only in the United States, but man, I'm so glad everybody else speaks English because everybody was able to communicate together, and it was just this huge broadened sense of how massive and then how lucky we were to all be together, right? It was a huge, like a combination of both that I'm only one little tiny speck, and it's wonderful to be part of this whole big piece of a puzzle, right? Um, the other thing that I loved about this experience was that it was evidence-based, right? So I put faith in the facts. So like I wasn't trying to convince other people, and other people weren't trying to convince me anything. They were just stating, hey, these are the facts. This is what we learned. This is what we did. This is the outcome, and this is what we learned from it, right? And it was just fascinating to see just the evidence behind everything. I know I remember meeting some of the authors of an evidence-based book while I was there, and I even had them sign the book of like, hey, like, how do I hone in on research questions, right? Because how do I, like, by the time I got to my project, it took like many meetings of meeting with the librarian, looking up this, searching it this way, trying to figure it out that way, and then lo and behold, the ultimate like project that it ended up being was very different than the first thing I researched, right? So how do we like fine tune that research process, right? And so there's lots of great advice and lots of great conversations on like how to shape future research also. It was very interesting. Um, the concurrent sessions, there was just research about everything, like 1,000 different topics of everything, things that I had both had some knowledge on and things that I had never heard of. And it was so interesting to hear even the people that I had not heard of anything about. Um, and then connect it to their face, right? Moving that research, like reading the article and then like connecting it to the researcher themselves and then being able to like meet them and then connect with them and then, exchange numbers or even just kind of like professionally find them on LinkedIn. And then just like learn from them too, like learn from not only their research itself, but their experiences as a researcher. And then be able to ask them real questions, right? Because when you read something and you're like, oh, wait, I don't understand why we did it this way instead of that way, you can actually ask them. In real life, you can ask the person who did the research for, let's say 10 years, and then you get a real life response. And it's not an email, it's like a real person. And it's just a phenomenal way to really like wrap your head around what was actually being done and then the impact on it on patients, right? That it actually had on patients. And so it was a wonderful experience entirely, but it was something that was very different and unique. Like to walk into like a global research conference, like that sounds great. But then what did you actually like do with that, right? How did we interact with people from all over the world? And it was a great experience to say the least. Also, there was great coffee in Seattle. That was awesome. I didn't know I was going to be such a coffee connoisseur when I walked in there and we got some free coffee tickets. It was a lot of fun. This was just a quick snapshot of what the concurrent sessions looked like, right? So the picture was of one of the concurrent sessions. This was actually one of the AI ones that Laura had alluded to. And it was looking at some of the responses. So like looking at previous AI, and it would give him like instructions of like, hey, create this simulation, or how would I respond to my kid when they're feeling sick, right? And then in the progression of AI and how to see how AI has advanced, a year later, they did the same question. And with those advances, what did that question look like, right? And they were comparing ChatGPT with Google Gemini, and the responses were just really cool and fascinating, right? So that was just one small topic. And then each concurrent session had multiple speakers in each one. So concession A, concurrent session A, I went to those two, and then B was all of those in one room. Concurrent session C was those two, right? And those are just ABC. So then to go to D, E, F, H, I, G, it was a whole list of everything, right? So this was just like a little snapshot of just a little bit of the titles of information that we got things from. And I just remember Laura and I went to one of the sessions in which it was like a mic drop moment. And I started clapping. It was just one of those times where you're like, oh my gosh, that makes so much sense. But it makes sense because you're saying it, right? And so this research that people have really spent a lot of time developing just was really, really interesting, just phenomenal. Also, we met amazing people, right? So we connected with one another, of course. We met people from Johns Hopkins. We met, what is his name? Lucas Davis, right? And he's the Sigma Chief Executive Officer. We got a chance to meet Burns. We got a chance to just hang out and go eat dinner and lunch and, meet people from like, there was a guy from India that we hung out with and had lunch with. There were people from just different walks of life. And it was just such a good experience to see how diverse we were all collectively together, right? It wasn't like, hey, this is what a nurse looks like. Nope. There was we were just so different. It was so wonderful to see how different we could be. And then all the things that we did. Laura and I even had time to work out every day. My rings were all closed. We tried the free coffees. We tried the lobster dinners. We went to France and had some phenomenal chocolate that we had to bring home for our families. We went to a baseball game and I won a free ticket. It was just such a great experience. By the way, I never win anything, but I won a baseball ticket. What are the odds, right? I woke up in time to see the sunrise. It was just such a good experience all around. We went to the purple store, and so that little quote, never question my purpleness. One of our friends that we met there loves purple. Like she was just wearing purple every single day. And so we went to the purple store for her, and it was just such a fun experience, really. Just in all avenues, right? It was an academic experience, it was inspiring, and we got some really great just connections with one another. It was phenomenal.
So I knew Christina was gonna cover our epic moments. By the time that I was preparing my experience, I saw all these pictures and wonderful stuff, and I was just like, okay, I'm just gonna focus on practicality.
You got
So,
it.
so first one is, so as you can see in that poor photo of mine, when I first arrived, I wasn't dressed formal, so I was like, oh my goodness, this is not representing USF correctly. I am gonna go to the restroom and change my outfit. So then I went to the restroom and changed it, but then one of the kind Sigma member who was leading this conference, she said, "Oh, I will hold on to this poster and I will put your name on it, and I will keep it here." So then I thought my poster was going to be stay there the entire time before I do the presentation. Oh, I had a very interesting experience of searching for my poster from the seventh, sixth, and fifth and fourth floor of the hotel. But I think it was such a practical advice that I can give out to people. Do not let go of your poster. And then don your mask. I was the only person who got sick in this trip. So I did not wear a mask in the airport. I did not wear a mask in the conference. I did not wear a mask thinking that I'm a superhuman. And I did get sick on the third day. And poor Christina was just taking care of me like a mama bear on the last day. So yes, dress formal from the start. So from the airplane to the conference, please wear formal because you can readily available to attend the conference. I learned that you have to be courteous and kind and patient because when I was like, oh, who is this tall guy? He looks very nice. He dressed very nice. And it turns out it was Luke, our chief executive officer. Look. And then he was like, hi, how are you? What's your name? Where are you from? What university are you guys from? And then we were sharing all this. And then, of course, I said, we thought Sigma was a scam because we got this email and they're saying they're wonderful, but we don't know what exactly it is. And Luke said, yeah, that is our work in progress right now. So I guess we kind of gave him a good feedback on that. So, yeah, be courteous and kind and patient and be professional because you do not know when you're gonna meet your CEO of Sigma Theta Tau. And have fun. I really have fun. We met, so I'm the person who really have a hard time stepping first step to join into the crowd. So like when I was so I'm still having hard time to be a nurse practitioner because I feel like their life is in my hand and I just don't want to harm them. And that fear kept me looking for a job. And Christina showed you guys a picture of these wonderful two ladies that we met at John Hopkins. These two ladies, Melissa, she was so supportive. She said, Laura, you have so much different nursing background. You can do this. She was building us. She was prepping us like, don't be afraid to be a nurse practitioner because she said it has to start somewhere. and she really built me up. Yeah, right. Oh, I think one more. Right there. So she is the person who's like right next to me. Yeah, that's Melissa. She and I have a similar background, so ER and all the oh yeah, and that look right in the between us. That's the time we met and talked about like, oh, we thought Sigma was scam. So that whole conversation. But yes, I think the practicality wise, the Sigma conference, like be ready, always be ready because you are presenting your university, and I really took pride. I really care that each of us, I think me, Christina, Kennedy, and Beatrice, we really understood that we are representing for University of San Francisco, and we understood what it means to us. And when we carried ourselves, we did carry ourselves proud, and we did carry ourselves that this is not just me, but it is our advisors, our school deans, and all wonderful board members and all these support that has poured into us that is now time to shine and support that other fellow, students that you can be the one. And this event, again, Beatrice, right? Inspiring, motivating, like how Kennedy was saying, and how Krishna is saying, eye-opening. I think it really summed up all that because I honestly thought like, okay, this is it. I'm done. No more. I am not going to do this again. But then I signed myself up in our work clinical inquiry committee right now. So I'm in one of the member of our hospital that I am helping doing evidence-based project. And I am going into all these committees since I'm in the central council. So I'm going to all these committees of uh, people and saying like, hey, evidence-based practice is not something foreign to you. It is not something difficult because I used to think that. And then I am now motivating other nurses to do it. And I can see that struggle and misunderstanding of how poor that EVP can be portrayed to the nurses. So I'm going to continue, and I wish I see my colleagues again at this Sigma conference again.
Very nice.
All right, so I wanted to highlight, also that's Laura. That was my picture that I took of her. Um, the vision mission that Sigma has. Okay. So the vision for Sigma was that it's that connected, empowered nurse leaders transform global healthcare, right? And that was so embodied in this conference. Developing nurse leaders anywhere to improve healthcare everywhere, right? And again, that global perspective was just so incredible to experience, right? To just see how many people are all together doing all the things. And then to connect it to USF, I put an excerpt of part of our mission statement and our values, right? So as a community, we empower and hold accountable our students, faculty, librarians, staff, administrators, alumni, and community partners to be persons for and with others, to care for our common home, including the native lands on which our campus resides, and to promote a common good by critically, thoughtfully, and innovatively addressing inequalities to create a more humane and just world, right? And I feel like those both align so well. At USF, we value three things in particular: cura personalis, being the person for others, and diversity in all its forms. So I feel like, again, bringing Sigma and USF together, it just makes so much sense because so much of it really aligns to that like global perspective, that innovation, that caring for people, that doing what's right for everyone, right? I feel like in that sense of camaraderie altogether, right? That was just so evident in both spaces. And then also that's me and Laura graduating together. And then this was us packing up to leave, right? On our way back when we were commuting, we were walking to whatever public transportation area we decided to take together because it was going to be way more financially responsible. So we grabbed our posters and walked our way together and then just our own flights home. So it was a great, great experience. I really want to thank everyone who helped support this initiative. Um, as you can see from each of us, we all valued this experience so incredibly much. So thank you guys.
Thank you, each one of you. This was an awesome presentation. I know that we can stay and have questions and more conversation. We are running out of time. So I just want to share with everyone, I put in the chat, we have your reflections on our website. So I did ask each of the students to put a reflection, and it is posted already on our website. I'll post this presentation. This was awesome. I think that you represented USF more and Sigma, also Beta chapter in an amazing way. So congratulations. I want to thank again the Sigma Beta Gamma chapter representatives, the support that you provided. I think this is a great outcome, and we're very, very proud of you. Mary Lou or Benson, do you want to do,
Yeah.
or Pat, do you want to say any closing words?
In terms of it's Mary Lou, and I, as one of the board members, and some other individuals might have a minute to say, but I just want to say how proud we are because I think it represents our mission for USF. And I know Victoria Chaudhry and I are friends, and I know she attended this as well. And she said that it was a pride to see how the students have applied this, the nurses and the FMPs have applied this to practice. So things have come a long way, and we invite you to become more involved because we do the same thing continuously, and it's not a scam. It's the real thing. And we want to encourage more people to participate because we make this our mission to have more service projects, to do leadership, and for sure to have you have more opportunities to provide to showcase your research. So please continue. I know that Benson, you might be on ready to say something, or Pat or Sarah.
Yeah, absolutely. Thank you, Mary Lou. I echo every single word you uttered to the team, to the groups, to the students. Nothing but really proud. And by the way, awesome presentations. You guys did a phenomenal job. And you answer my questions already, which is I was going to ask, would you recommend this to your peers, to your friends? So absolutely sounds like you guys had a wonderful time networking, learning, growing. That's exactly what we look for, what our aim and mission is. Well, not just Sigma, but USF, and in terms, in the biggest sense, nursing, because really it is very important that we help support each other. So I do have one ask to all of you: share this with your colleagues, friends, peers, even family members. Like you said, if Sigma is a scam, I've been scammed for 30 years, so I can tell you that much. So please do share this with your loved ones at how proud we all are for each and every one of you. So congratulations.
I also wanted to make a comment. I was very impressed with the presentations that all of you made. I really, it was amazing. And having been a former associate dean at the University in Nursing, I couldn't be more proud of you. If I had been the one that encouraged you, as you have been encouraged by people like Mary Lou, I think that's just great. And I'm glad that you have her there to be able to give you that encouragement. I'm sure you're glad too. And as Benson said, I hope that letters are going out now to students to invite them to become members of Sigma. And you're right. I think maybe we haven't done as much as the chapter to explain to you what Sigma is all about, or whether people aren't ready to hear about global practices. But I hope that you will help those students who do get these letters to recognize that this organization is something that not only benefits them, but the world, certainly nursing. So thank you again for your presentations. I thought you were just marvelous. So thank you.
Love that, Pat. I'm Sarah. I'm also on the board. And I just want to say that don't walk, run to become a member. If you are already graduated, you can come back as a nurse leader. Everyone is a nurse leader, whether bedside or, taking on additional responsibilities. But loved your experience. Thank you so much for sharing again. Sigma is the largest nursing organization worldwide that connects us all to really be instrumental and influential in policies and making our, nursing practice safer and around the world. So really, really love it. And, it's a very prestigious organization to be a part of, as you saw, firsthand. I went to the biennial, they call it the biennium, and the same thing. So it's like yours amplified even more with more. It's huge. Like you want to talk about getting your steps in, you're going to get tons of steps in, and networking is so key. So I'm glad you met wonderful, wonderful people who have been exemplary contributors to the nursing profession and practice, and keep carrying that torch. Because no matter what you do, it looks like you guys are all wonderful examples of, nursing professionalism. So continue to keep doing that. And thank you all. I got to jump to another meeting, but please post on LinkedIn, tag me, and then I'll repost it and share. And then we can also put it on our Sigma website as well. So thank you all again. Bye.
Thank you, everyone. Good job.
Thank you.